I'm going to ask our panelists to join us, Diana, Peter, Sarah, and Juan. And while they're coming up, I'd be surprised if you were not stimulated by a few questions of your own. You should have comment cards, so please write your questions down. And who will be picking them up? Someone will be. Okay. We'll be picking them up. So we want to get you involved in the conversation. And then I'll be reminding you, I hope you'll stay with us. We're going to end right at noon. And please don't forget to fill out an evaluation form. We want to know if this was helpful and how in the future we can make it even more helpful. But I get to start asking the questions. Juan, I'm going to start with you. You're the journalist, and if you were writing a headline for tomorrow's paper in the community that you serve, what would be that headline based on what you've heard?
I think the headline, it would be hard to just boil it down into just one headline, but I'll give it a try. It'll probably be long.
Okay.
But it'd be California voters support expansion of healthcare to undocumented residents.
Okay.
So that's what I drew from this, and I think that it shows that California is probably leading the nation in terms of how it treats those that don't have good access to health care or have not had the chance to tap into the health care system. So that's how that's basically the headline that in the Sacramento Bee. That was a headline this morning. That was the thrust of the story. That's something that it's great news. It's great news to know that I think California places a value on the working class.
Okay.
And in the San Joaquin Valley, farm workers, 80–90% of them are undocumented. They're not covered by the Affordable Care Act. And I know there's been efforts to try and get health care to these individuals throughout the years. I believe about 5 years ago there was a group led by a Sacramento consultant to try and provide health care to not just the undocumented, but also farm labor contractors and farmers. And it didn't go anywhere, I think, because of the cost. So the cost is going to be the next
cost
big
is going to be.
question.
We're going to talk about that. Diana, I had to chuckle because I'm sure you did when Mark said that Californians no longer view Medi-Cal as sort of a niche program. I'm sure in your world it's not a niche. Were you surprised at the fact that there was thumbs up in terms of the importance of Medi-Cal in the lives of Californians?
Not at all, Judy. That trends very closely with our own monitoring and engagement with the beneficiaries of Medi-Cal and with polls that have tracked by the foundations over the last few years with the satisfaction of the people who receive their care through Medi-Cal. We do hear a lot of noise, a lot from people who want to be paid more and people who want to see their doctor more quickly or more frequently. But that really cuts across all of the healthcare. I'm particularly impressed with the finding, as Mark pointed out, with the trend in the overall perception of the way the healthcare system works, that they see the healthcare system working better as more people have access to care. I think is in part reflective of the changes that are being made in the way that care is delivered. There is more coordination of care. There's more engagement with more kinds of providers of care. We don't only get our care from our physicians, and the way we pay for that care has changed. And those trends I will be very interested in over time. But I'm not at all surprised with the perception of Medi-Cal as an important part of our delivery system. I think we are moving toward having Medi-Cal, covered Cal, and employer-sponsored insurance. And when everybody's in the system, we can make the system work better for everyone.
Yeah. And Mark, to follow up on that, my sense was that even those who were not directly benefiting from Medi-Cal were seeing the value of Medi-Cal. Am I overreaching on that?
No, most definitely. I think especially those who are concerned about the underclass. I think the Democrats are the most likely segment to be saying that, but they're joined by the nonpartisans. And what's an increasing trend in California is the no-party preference voters are the fastest growing segment of the voting population, and many of them are comprised of ethnic voters because they have no strong ties to either the Democratic or Republican parties, and they're quite empathetic towards the underclass. And I think that's where Medi-Cal and support for Medi-Cal and the perception that it's working and that it's important. They know people, either their friends or their families, if not themselves, who to whom it's an important program.
Yeah, Sarah, I was a little surprised at the fact that there seems to be stronger embrace, if you looked at it from an ethnic, from African Americans and from Asians, but higher than Latinos and whites. Does that surprise you?
For the Medi-Cal program?
Yeah. There was sort of a distinction, I thought, Mark, that you made in your remarks about just support in general, or was it for Medi-Cal, or was it for ACA in general? It was Medi-Cal, right?
Medi-Cal and its importance to voters and their families.
Yeah. And do you have a sense of why it might break out like that? Sarah, any sense?
I think overall it seems like there's definitely a strong support among all of the ethnic groups for the Medi-Cal program and also for the Affordable Care Act. It seems like there's, good, Peter handed it here to me. So the importance of Medi-Cal. So it looks like the Latino community at 66% is supportive, the API community at 61%, and then the African American community at 55%. And I think those all trend along sort of the enrollment that we see in the Medi-Cal program and just the importance that that program has specifically for their community. I think I was in some ways very, very pleased, and in some way much more pleased to see that overall Californians really see the Medi-Cal program as important to themselves and their families. I think it just goes to show how connected we are to individuals who are most likely enrolled in the Medi-Cal program and who see it as a really important piece of, as the Secretary said, our healthcare delivery system.
Okay. Peter, folks are going to your site. They are hanging out there, and once they get there, they're liking what they're seeing. So surprised? And even folks that, may not even, be using it, they're going there for information. What are you doing to get them there?
We're getting the word out a lot, and the fact that almost half of California's voters have been to coverageca.com to look at the site really shows a couple things. First, obviously, the vast majority of them aren't eligible for either Medi-Cal or Cover California, but virtually every Californian has a family member or a friend that can benefit from the expansion of coverage. And we know that from other surveys that the number one way that people get into coverage, whether through Medi-Cal or Cover California, is hearing from a friend or family member. So the fact that we've had so many voters, it shows what a fabric it is of people taking care of one another. The fact that so many had a basically positive experience is good news. There's still a mythology that's years old from the early healthcare.gov IT stumbles that these IT systems aren't working well. And few systems are working perfectly any place, but the vast majority of people that are on this site are getting access to care. And remember, it's important to note that the website is a website for both Cover California and Medi-Cal. Instead of a single point of entry that we've had millions of people get coverage through. So the good news for how people are seeing both the implementation of the Affordable Care Act at large, Cover California and Medi-Cal, is really a story about a state which has stepped up across the state and made health reform work.
Well, let's talk a little bit about that. I'm wondering if you're getting calls, from your counterparts around the country. I'm a native of Virginia. It's one of those states that has chosen not to take Medi-Cal extension. So family members, still struggling with we're trying to get health care there. So are we just in a bubble here in California? I mean, why are we trending in such a different way? And I'd love to hear from everybody on this.
Well, I actually talk often to my colleagues in other states and to folks in the federal government about what's working here. And there's a lot of things working in California that are also working in other states. And I want to note that this isn't a story of California exceptionalism. It is, though, a story that really highlights if a state puts the politics behind and says, let's focus on getting the job done. The voters recognize it. They see the success. And that then has its own positive, virtuous cycle. And one of the things I was struck by was of the many people that have come to our website, if people come to the website and they don't like the Affordable Care Act, they think the site doesn't work very well. Well, we don't have a different website for people that do and don't like the Affordable Care Act. It's one website. But I think it's very important having more people with a positive experience means people are more apt to say, I'll kick the tires, see what these subsidies are like. And so success builds on success. And I think we're seeing that in California. And I do think that, I know we're going to talk about affordability more later, but California's used every mechanism we can under the Affordable Care Act. And they're all part of a broader fabric that's actually paying off, as Diana noted, not just in terms of premiums, but in terms of a better health delivery system. And that's really great news.
Juan, what are you hearing from your colleagues across the country? They think we live in a bubble out here, and how do you respond when you say, when people say, why does it work here in California?
Correct. Well, first of all, I want to give Covered California an A on what they've been doing with their website. I know that when we first started out, I mean, there was just some stumbling steps that were taken at the beginning, especially when it came to reaching out to the Latino community. The early figures showed that Latinos were not enrolling in as great a percentage as compared to the population that was eligible to enroll in the Affordable Care Act. To your question, I just think California is a trailblazer. I know that it's a diverse state, not just in terms of ethnicities, but in terms of languages spoken. There's a difference between a San Franciscan and an LA resident. Someone lives in the Mojave Desert or in the Central Valley. It's a white state, but a big state. But I think, as Peter said, you put politics aside. Healthcare, I think, is becoming more of a necessity. It's not so much a privilege as some people who oppose the Affordable Care Act have tried to label it. So I think it's just the state is sort of like a step ahead of the nation, and I think that helps breed the push for the Affordable Care Act to be successful. And now that it's successful, then there's a huge percentage of the population that is not covered yet. So that's like we're ready to take that next step.
One thing I'd like to point out as well, just to follow up, California is a trailblazer in terms of the composition of the people who live here, in terms of the demography, not only of its overall population. As a pollster, I was for many years worried that the demography of the state's adult population wouldn't really be reflected by the state's voters. But increasingly, voters are taking on the shape of the state's larger population. Now 40%, I think it's 41% of all registered voters now are ethnic voters. I think that's way higher than the rest of the country. I think that's one of the reasons, too, why there's this greater openness and acceptance of this law.
Sarah, you've been part of a community that's been advocating for this for years. What would you say to your other counterparts around the country that made it work here? Why did the advocacy community play such a huge role?
I think a big, as others have mentioned, the leadership of the community, I think, has been really essential in making the Affordable Care Act work as well. think one of the successes that we've seen is that we've had great, so I do have to acknowledge that we have great leadership in California. If it hadn't have been for Director Lee, for Secretary Dooley, for the governor, for the legislature who have really stepped up to make this happen, I think we would not be where we are today. And complementing those efforts has been the role of community members. You know, people have rolled up their sleeves. They have translated materials for communities that weren't able to get information. We've had individuals who've routinely come to Sacramento to talk about, you know, what's working, what's not working, and we've had a responsive leadership who's been able to take those things into consideration. But there was also a momentum that has been building. So in 2007, for example, you know, a group of community members came together to look at healthcare reform in California, and that group has stayed together. And so part of it has been that there was a momentum in California, that California itself has had a deep commitment, I think, to the immigrant population, covering individuals who, you know, for example, weren't able to get coverage due to the 5-year bar. So we've had some sort of steps in place that, you know, the momentum has really taken us forward, both with the leadership and with the community members themselves.
Okay.
And Judy, I'd piggyback on that. One of the things that I think is so remarkable about the work that the field organization has done and that Mark has led is that the longitudinal character of this information. And as Sarah pointed out, in 2007, the previous administration had a proposal that was modeled on Romney Care in Massachusetts, and then it became Schwarzenegger Care in California, and then it became Obamacare in Washington, but the basic elements were all the same. It was a market-based system, incrementally changing, and not so incrementally. I mean, we're making pretty dramatic change, but we're building on the system that existed. And the number that jumps out at the top of Mark's data is that they started this polling in 2008 with the leadership from your organization, and it's moved 10 points from 52% approval in 2008 to 62% approval in 2015. And that is because it has been broad-based. We haven't suffered well, the numbers are partisan. Clearly, broadly they are, but there have been partners from both parties and all participants in the provider community and in the advocate community to sit around tables much as this one and figure out what we need to do and do it together. And I think there is no secret sauce that is any more predictive of success than working together.
Right.
And, you know, checking your hardware at the door and figuring out, you know, what can I give up? What do I have to get? How do we make this work with a North Star? And the North Star for us in California has been better health, better care, lower cost. And the Affordable Care Act has created tools for us to make that movement. But we're still pretty much at the beginning. You know, we haven't even reached adolescence yet in this transformation. So there is a lot of work left to do, but I think Sarah and Juan have clearly articulated the depth of the commitment throughout California. So I think that's really a part of this.
Speaking of trends, you know, one of the joys of this job is that I can just focus on our mission, which is really to provide health care to underserved communities. So I don't have to worry about immigration status or whatever. Our goal is to, in a compassionate way, believe that every human being has a right to health care. So one of the trends that was encouraging to us was the change in attitudes from voters about services to the undocumented. Mark, can you just talk a little bit about that more? And then I would love to get a reaction. As you know, there's been a lot of chatter throughout the country on the whole on this issue. And is this an area that you think that others might also learn from the great Golden State?
Well, it's certainly a politically charged issue. You can see there are strong opinions on both sides here in California because the dominant view is really pretty much expressed by Democrats and no party preference voters. Their will is prevailing on this issue. Republicans stand opposed. It's not surprising to hear candidates running for the Republican presidential nomination even Republican U.S. Senate nomination here in California taking positions against the Affordable Care Act and against the expansion of health coverage to undocumented. So it's a charged issue. I think the issue will be fully joined when the matter of costs gets raised and how much will this actually cost to the state. I think voter opinions now are kind of in the concept phase, but they're moving in the positive direction. That's an encouraging sign for advocates. But I think the details will govern how far this issue goes.
Juan, thoughts?
Yes, I'm not one that deals with the budgeting and trying to come up with the funds to make a program work. I'm not a bureaucrat. Mm-hmm. But I can tell you one thing. I know that ever since I've been involved in journalism and done stories, coverage of healthcare and access to healthcare, it's a lot easier to spend a few pennies right now to take care of the healthcare needs of an overall population than to spend many dollars later because something went untreated. Mm-hmm. So if you take the politics out of it, I think it makes economic sense to do something like that. You know, you go to the dentist, you get your teeth checked, so that 10 years from now, if you didn't take care of them, you know, you're going to probably need replacement, root canal work, dentures, whatever. Mm-hmm. You know, so I think that, you know, people need to take a look at it from an economic sense. Now, how to fund it, you know, I'll leave that up to the politicians and the healthcare professionals to sort of come up with an ideal. But I think when the public is presented with that, you know, either set aside some money right now or face a greater cost down the road.
So I think taken together with the voters' belief that the ACA has been successful really paves the way for showing it's time to then build on that momentum and expand coverage to everyone. Mm-hmm. We're doing that in California for undocumented children, again, thanks to Senator Lara, the governor, Secretary Julie. We're taking some steps forward to make sure that undocumented kids are covered, and we actually have bipartisan support for that effort as well. So I think as we continue to see the improvements, as we continue to build upon what we've created in California, that more and more voters will potentially come along. My sense is also that within communities of color, I think we've seen an increase among communities of color also supporting this. And our sense is that because communities of color, African American, Latino, Asian Pacific Islander communities had gone so long without insurance, that now having access to care also shifts people's mentality, that it has helped. It's helping people get covered. It's helping people get healthy. Why should we continue to lock people out of a system because we have an unfair immigration system and because we haven't been able to make that change at the national level? So I think, you know, excluding people simply for that reason, I think it's not making sense anymore, and we need to continue to build that momentum.
Yeah, it's a segue in terms of the issue that the voters are not so happy about, and that's affordability. And it plays out a variety of ways. One, just affordability regarding care. And then even when we all may agree that we want to provide additional resources, unfortunately, Diana, you're one who has to worry about where's the money coming from. So let's talk about affordability in both ways. One, Peter, were you surprised that I think the voters gave us maybe a C on affordability around costs?
Yeah. Not surprised at all. I mean, the thing that, and I really want to note one of the things that Diana noted is that we're in our adolescence of implementing the Affordable Care Act. We've done a really good job at expanding coverage, but health care is wildly expensive in California and America, and we're all paying the bills. We're paying it because we get paid less in our jobs because it's a huge part of what employers pay. We pay for it through Medicare, which is a huge millstone around the federal budget. And we're seeing it, as Mark noted, in every income level, paying for health care can be a problem. Even people that make over $100,000, almost a third, have challenges. The good news is, though, even when it's difficult, is people have coverage now, and now are not going to be losing their homes, now know that they can get access to care when they need it. And the other good news in the data is it's getting less difficult, substantially less difficult than it was before the Affordable Care Act. So the fact that we did not overnight make health care inexpensive in America, but we're making progress. And this is where we need to keep on building on what's there to now take the next steps to say, fine, the delivery system's better from consumers' perspectives. How do we address all elements of that triple aim, which is both making sure people get better quality care, but also lowering costs. And that's one of the things that we now have tools to do that I think we're going to play out in the years to come.
So what are you doing to help, and why is it more expensive? I mean, I'm sort of being provocative, but I think there's an assumption that with ACA we're going to get access, plus it's going to be less expensive.
Let's be real. I mean, one of the really important findings of this survey from voters is that a substantial majority, 56%, said that what they paid for health care was about the same or less than last year. That's huge. Healthcare historically is going up 10% a lot. So the fact that a substantial majority of Californians said that this year their healthcare expense was the same or less is an incredible market success. So I want to be really clear that that's, and that's, again, people think about things like Medi-Cal and Covered California for those that have subsidies. But when we at Covered California negotiated a 4% rate increase, that benefited almost 1 million Californians that are not in Covered California, that are in the individual market, that now benefited from our negotiating on their behalf. So the stories here of difficult to afford, yes, but it's getting better in terms of it's more affordable than it has been. So I just want to that we're often a glass half empty kind of society, and there's a lot of good news here, even around affordability. The other thing that we've seen is, and we've seen other polling data that people in Covered California say, it's hard to meet their bills, but they're meeting them. They're staying insured, and so difficulty doesn't mean people aren't getting access to care. And we need to connect those dots. That it's a matter of how do we make sure that we have benefit design so people don't have deductibles in the way of them getting access to care. We do that in California. A lot of other states still need to learn from us on that.
And, Peter, I remember hearing you speak about a year ago, too. You also said that another related cost was making sure that we hang on to folks that are enrolled in terms of center. How has that been going? Have we been able to do that?
Absolutely. We've seen, incredible stickiness of people once covered, stay covered, unless they get a job and have new health insurance coverage through their job. So the individual market, which is where Covered California lives, is always one that there's substantial turnover every year because people, have individual coverage after they lose a job or they move to the state, but then they get a job with insurance coverage, they move out. So one of the sort of untold successes of Covered California is there's over 500,000 Californians who have had coverage with Covered California for some of the last 18 months and don't today. And that's not an issue of they can't afford it. It's an issue they now have coverage through Medi-Cal, through employer-based coverage. And now we do have a full continuity, as Diana noted, a continuity of people that have options in Medi-Cal and Covered California and employer-based coverage, and across the board with new insurance rules that insurance companies can't turn you away. They can't rate you differently because of what your health conditions are. And this is one of the issues on affordability that I think we all need to focus on is, because of the insurance rules, the 12 health plans that are in Covered California will have an average profit next year of 1.1%. Well, that's a pretty marginal profit. Pharmaceutical industry has an average profit of north of 25%. Those are baked into our healthcare costs. And I think we need to, put a spotlight on some of the underlying drivers of costs, which are no longer about health plans raking in profits. It's about the delivery system and elements that are doing care that doesn't need to be delivered, and some parts that really are making profits that we're all paying the price for.
Diana, what about the Medi-Cal? I mean, if you talk to states who've chosen not to, but one of the reasons they always cite is, the long-term kind of costs that comes with the decision of extending Medi-Cal, whether it's a partisan reason or not, at least it's out there. How has California managed, and what do you what keeps you up at night about the affordability of trying to provide health care to all Californians, especially underserved?
The costs are very real. And I think they are the underlying costs. The premiums that the insurance companies charge us are reflective of what they pay for the care that we get. And there are a few parts of, most of the conversation around the Affordable Care Act has been around coverage expansion. And that is one important part of it, but there is so much more to it in the changes to accountability in the way we pay, the way we consume, and our own healthy communities. There are a lot of parts of the Affordable Care Act that we've also embraced in California that lead to more healthy communities. And a little talked about part is patient engagement. There are a number of aspects of this that deal with the patient's responsibility in the healthcare, both their own health, but in their consumption of healthcare services. When I worked for Governor Brown in the 70s, the Medicare and Medicaid were only 9 years old. They started in 1966. We took office in 1975, and we were already in second-generation cost control that way. At that time, we in California tried to control costs by controlling capital investment. There was a program called Certificate of Need. In 1982, at the end of his term, we established a commission to set hospital rates. And for 30 years, we successfully negotiated with hospitals, so successfully that we got hospital rates to a point where we couldn't get contracts anymore because we were low. We have one of the most efficient Medicaid programs in the country, and we're constantly criticized because we pay the lowest amount per beneficiary. We provide care to 12.5 million people. A third of all Californians are getting their care in Medi-Cal, and we pay less than any other part of the country. Having said that, we pay $95 billion. So in terms of perspective about what other states are looking at, in 2020, our share of the expansion population will be 10%. In the first year of that expansion in 2014, the amount that the federal government paid in California for the care of 2.5 million people that were newly eligible was $20 billion. You don't have to be a math whiz to say 10% of that is $2 billion. So by 2020, our general fund cost just for the expansion population, if nothing else changed, is $2 billion. So our concern about how we're going to pay for in the future is real. We have to be looking at both setting aside and not overextending on the benefits and add-ons. There's always need. Everybody has more need. Everybody wants to be paid more. They want to get more services. They want to expand coverage beyond the levels that we currently have. But we've got to look at how we're going to pay for it, or we're going to return to the best period that when we came into office in 2011, we took the baton of commitment to the Affordable Care Act, which was a great thing to take over and get to lead. But we also took a baton of a $27 billion deficit, and we had to make reductions in programs. I don't want to be in a position to either preside over that or to leave that as a legacy for the people who follow us. So we have to be prudent in planning for that. In 1975, healthcare costs in this country were about 5% of GDP. Everybody was wringing their hands saying that's unsustainable. And then it went to 8% and 10% and 12%. It's 17% of the GDP now. In every other industry, when you get a lot of production or a lot of innovation or new technology, prices start to come down. An iPad starts at $1,000 and then it's $200. It goes the opposite way in healthcare. It doesn't matter how much innovation we get or how many new procedures or diagnostics or pharmaceuticals, the number just goes up. So I don't even know that we can stay at 17% of GDP. We are consuming health care at costs that feel unsustainable, but for 40 years we've been saying they're unsustainable, and they've continued to go north. So it's a serious concern.
But you look so well rested. You don't. I mean, my heart is beating.
We do. It's hard work. I'm just saying it's hard work to balance making incremental changes that move us in the right direction, but as we try to persuade people to think about what they need and when they need it and how soon they, everything has a cost. If we have more people that can see us more frequently or more often, which is what we talk about in access, it's going to cost more. What are we willing to wait for? What are we willing to defer? What are we willing to pay for ourselves? So we have a challenge in rethinking our relationship with our own health, and that's why our health is different from health care. Right. So getting healthy is a part of the Affordable Care Act as well.
Hearing that, I mean, Juan and Sarah, I mean, you guys are out with your, fingers in the community, and you're kind of hearing from folks who they say they get a lot of sleep. I don't know how you guys do it. I mean, how do we deal with that with expectations? I mean, because we have kind of opened the door, and I don't think you're saying we're going to go back in any way.
I don't want to.
We're not to, but I mean, any advice, or how do we deal with that in terms of communicating already with a state who's just saying they're a little concerned about the cost?
Sure.
Any thoughts?
I think, we recognize and have also done some work on determining what the cost would be to do expansions. I think that Secretary Julie also touched upon the way in which the Affordable Care Act offers us opportunities to look at how do we change or make changes within the healthcare system that also improve health. So patient engagement is really important. I think as long as we're also knowing about the population that we're serving, that information is available to other languages, which the poll also touched upon, and really thinking about the delivery of care as well. So focusing on chronic care management. I think those are some of the ways that we can look at potentially keeping costs down. And then also I think the Secretary briefly touched upon the upstream approaches to health too, right? So looking at poverty, looking at jobs, looking at better education, creating communities in which people are not getting sick, but that they're actually promoting health. And so those are the other ways that we need to marry the healthcare system so that it is, that other resources that the rest of the state of California is investing in are also promoting healthy communities so that we can, again, mirror that with the healthcare system. And I think, again, looking at the poll and sort of where voters sit on the support for the minimum wage also really speaks to affordability, that poverty is one of the greatest predictors of one's health. Right. So it's not about healthcare coverage, it really is about whether or not you're in poverty. And I think what the support here is showing is that, that wages have not increased while all other expenses for housing, for transportation, for food have been increasing, that people need to see that their wages and their ability to provide for their families are also increasing as well.
Juan, what about you? And it's really great that you brought in the minimum wage because, as we talk a lot at CalWellness about the social determinants of health, which basically says people's race, their income level, where they live, and all of that impact how well they're going to be. And so we were intrigued and somewhat encouraged about, it appears to be a recognition on the part of voters regarding that. Any sympathy for the challenges that Peter and Diana are in your reporting as you go out?
When you talk about expansion to undocumented residents, I mean, it's a huge challenge in just getting the information to those undocumented. I was talking to a friend of mine last night. She does tax returns for a large percentage of our clients are farm workers, and some of them had to pay the tax because they didn't have health care or they weren't enrolled, and so they had to pay the penalty. Their thinking was that I know how to spend my money. Let me spend it. I need to spend it on food, rent, gas, whatever. So the mindset there is that they've been used to not having access to health care, and then all of a sudden if they're told, okay, this is what you're going to get, and this is what your cost is going to be, their immediate thought was, it's going to be, I'm going to be spending more money. So for them, affordability becomes an issue, even though in the long run, like I said earlier, it's a benefit to them, their family, and the entire community as a whole. So it's just the educating and the communication, working with those individuals, because you would get the sense that according to the poll that undocumented residents are, they want the health care. Well, I think it comes with a price, and they have to be made aware that if there's going to be a cost that they're going to have to pay, that they become aware of it, and they're told, okay, this is why this is going to cost you this much.
One thing that I'd just like to connect the dots to is that this issue about Medi-Cal and the state's budget challenges are being faced by every single employer in California every day. I mean, there's issues of how much health care costs is one of the reasons wages haven't increased. We've seen for the last 15 years the rising health care costs has been one of the major reasons that wages have not increased, because health care expenses as part of employment have gone up and it continue to go up. So the budget challenges, which are huge, that Diane and the governor faced, are being faced every single day by large and small businesses, which is why the Affordable Care Act, getting our arms around this 17% of GDP going towards health care, it is a problem. Right. It means less money is available for schools. It means less money is available for wages of people that are working in retail and working in the farms. And so this issue is one that is an interconnected issue.
Okay, great. Well, you guys have generated a lot of questions from the audience. I think I have a question almost for everyone. And I'll try to get through as many as we can, but we're committed to having you out by noon. Peter, there's a question where someone said, going back to undocumented, is there any chance, I mean, that there are undocumented who say, well, I can afford to pay for health care on covered California. Is there a chance that they could get a waiver if you're undocumented, that they could afford it, they're ready to, but feel like they obviously can't because of their immigration status?
Well, so let's be very clear that today in California, people that are undocumented can get the benefits of the rates we negotiate in the individual market. There is no prohibition on people that are undocumented getting health care, buying direct from a health plan on the rates and the benefit terms that we've designed. We at Covered California they can't buy through us, given the federal rules, but it's very important for people to know, and I'm sure there are, I don't know how many, because right now in the individual market, that million people, it's 900,000 people that have individual coverage that buy direct, they aren't asked about immigration status. They're just said, step on up. And so I think one of the things that's important is that immigration status isn't the barrier for access, it's affordability. And this is where the issues around this is that we've seen again and again that the reason people struggle with getting coverage is it's too expensive. So the political issues aren't opening our doors. The issues are really ones around affordability.
And could we get a waiver? I don't even know.
Well, let me just explain what Peter's talking about. The way California passed laws that said every product that we sell on the exchange is available off the exchange. So you can buy it. You can go to the website. You can see what the products are. And you can't buy it on the exchange, but that same product is available at that same insurance. So you can go to Blue Cross or you can go to Kaiser and you can say, I want the bronze plan XYZ, and you can buy it.
That's the exact same price.
At the same price.
And so the issue of the product being available, the problem, as Peter says, is the affordability. If you want to buy, the reason you would buy it on Covered California is because that's the only place you can get the subsidy.
Right.
The subsidy isn't available in the off
But if
exchange,
you're
but the product is exactly the same.
Okay.
Absolutely.
Great. Mark, 2 questions. Folks want you to expand your already very lengthy survey. One, they wanted to know, did you and why not ask any questions about the high cost of specialty drugs? Did you even touch on that? And
what about that, Mark?
Yeah.
We all know what everybody thinks about it. I don't think we have to poll anybody. We all know what we think about a high cost drug.
Someone was very concerned about, the increase that diabetes is the 7th largest cost. They wanted to know, is there a way that, maybe next year we could add something about the tax on sweetened beverages, sugar-sweetened beverages, because they noticed, as you mentioned, that there was a question regarding voters' views on a $2 tax on cigarettes to pay for more public education around healthy. So why did you choose what you did?
Well,
And
we're
how to
always
make it more on.
well. Whenever there's a field poll, and it's not just for this particular health policy poll, but what we're doing in assessing questions is we're looking at either the legislative calendar or what's coming up in the next election. What are the issues that are most likely to be facing voters, or what are the issues most likely to be facing legislators in their day-to-day activities? So the reason we have the $2 tobacco tax is that it is now on the front burner, and it's looking more and more like it could be on the 2016 election ballot. We have polled on sugar-sweetened beverages in a number of field polls, and there is general support for it statewide, but it is pushed back by the beverage industry in terms of their being able to mount challenges to it in the legislative body here. But you can demonstrate that there is majority voter support for the concept. It's just you can't get that to be weighted enough to overcome the objections of the beverage industry. Also, when you look at the beverage industry, and I would say this will also apply to the tobacco industry if indeed we have a tobacco tax next year, they have been very successful in beating back questions of taxation where voters originally or initially started out quite supportive. In fact, you can look back, I think it was 2006, the last time we had a very significant tobacco tax increase proposition on the ballot. Our first measure, which is comparable to what we're doing now on this year's tobacco tax, was 2-to-1 in support. However, as you got closer and closer to the election, under the weight of campaign advertising by the tobacco industry, our final poll showed it dead even, 45-45, and it went down 52-48. I'm not predicting that for next year if indeed voters vote on it. We have a somewhat different electorate now than we did back then. But the weight of the lobbying of the interest groups, the tobacco industry, the food and beverage industry, is significant. It's significant in the legislature, and it will be significant in the public airways when we have campaigns.
Thank you. One, there's an interest in trying to get a better understanding of what's happening in the Central Valley. Noted that that it's an area high need, under-resourced, wondering if the fact that there's not quite as much support than Mark reported for San Francisco and LA. What's happening there? What do folks need to know, both from funders and policy leaders, about the needs of the Central Valley?
Well, looking at the polling, you would think that the Central Valley is against the Affordable Care Act, but we need to realize that this is a survey of registered voters, and undocumented residents can't register to vote. So there's a huge population in the Central Valley. The Republicans that are elected to office from the Valley tend to be a little bit more moderate. We have Congress members who support immigration reform more so than in other parts of the country. So they're a little bit pragmatic in their approach to the needs of the community. Yet, I think the 21st Congressional District, if I'm not mistaken, it runs from Fresno to Bakersfield, was labeled the poorest district in the country, almost like people call it the Appalachian of the West. And things have not changed in the last 20, 30 years. I've been in Fresno 25 years, and we haven't seen significant increases in that. And I don't think it's something that can be corrected overnight. I think there's organizations that are spending money and resources to go and find what the needs are. There's when it comes to healthcare, there's an expansion of health clinics in the area. In fact, some of the health clinics, one director talking at a panel discussion in Fresno last year said, if you can't find health, if you can't go to your doctor, because I think at that time people were saying, hey, I can't go to my doctor, I'm under the Affordable Care Act, and doctors aren't taking me in, or maybe they're not accepting Medi-Cal patients. He said, come to our clinic. We have the best facilities, A1 condition, and there's no wait for you. So I mean, there are those little incremental changes that are taking place, but it's gonna, it's more than just healthcare. I mean, we're talking about education, we're talking about jobs, we're talking about jobs with benefits, we're talking about year-round employment. Okay. All those things, little by little, they need to be done. In fact, I always wonder if Fresno's ever going to become like Flint, Michigan. The documentary that was done years ago, where here's a city built by the car industry and gradually falling apart. The city government spent money on a convention center, hoping that it would generate the economic activity needed to bring it up by its bootstraps. But having said that, agriculture still drives the economy there. Kern County is number 1, Tulare County number 2, and Fresno County number 3. Their ag numbers came out within the last 3 to 4 weeks. Fresno's came out this week. So despite the drought, the farmers are still doing good. There's reports that the drought has cost farm workers, 18,000 farm worker jobs. So it's a community that's still struggling, but yet, there are parts of the economy that are doing good. I'm not saying that the farmers are getting rich. I'm just saying that the crop production value is still high. Okay. So they find a way to do that, and I'm sure that somehow we'll find a way to, bring up the Central Valley. Congressman Javier Becerra was in Fresno last night, and he did say that as the Central Valley goes, so goes the nation. And that is so true because of the value of the farm production there.
Thank you. Sarah, one of our audience members, they're concerned about the rhetoric in the political space regarding undocumented, and wondering that as encouraging as the stats are, that, and this might be another question for you too, that is it possible that with all of the chatter that we could see an erosion of support, even in California, for extending benefits to the undocumented, and especially, interesting enough, knowing that there's a cost attached to it. So what are you hearing and seeing on the ground? Do you think this is a trend that's going to continue? Are you and your supporters concerned as we go into an even more political environment?
Sure. I'm reminded of Prop 187 several years ago, almost 20 years ago now, I think. And the result of Prop 187, which was basically, limiting or excluding undocumented immigrants from a variety of different healthcare services. What that did was it really galvanized the Latino community to become registered voters, to become citizens. I think that, political leaders today who choose to have the vision that, our residents in the United States are not contributing, that the various different ideas that have been put out there, they're making very drastic mistakes. As Mark noted, in California, you cannot win an election if you don't have the support of communities of color. And so I think more and more we see leadership that is reflecting that commitment, that understands the benefits that undocumented and other immigrants make to the United States. So I think in terms of the larger political sphere, that we as a nation there's a lot of wounds that have been that we need to heal from, or that we need to start addressing, from police brutality to immigration. There's a lot of different issues that we're, I think, facing as a country. California, if we continue the way that we're continuing, which is being a leader and being inclusive, I think we have the potential to really influence the nation, and to show the benefits of all of the residents that we have in California. The other way to look at undocumented immigrants is they really are tomorrow's voters. They're tomorrow's citizens, and we have a lot of communities that come from mixed status families. So I think some of the efforts that a lot of the advocacy communities continue to push is we need to be more. We've been very inclusive, but we need to be more inclusive, to have the continuity of care, to have information available in other languages. I think 87% of the non-English speakers surveyed would want to have more information available in their language. So we're making efforts, we're making strides. I don't want to take away from that, but I think we could continue to be better, and that's, to me, the other reason why people want to have Covered California and sort of all doors open to every individual, is to make sure that we're being continuing to be very inclusive and being a leader in that way.
Okay. One more question from the audience, and then I'll give an opportunity for you guys to say the last word before I give some thank yous. Peter, or really, Diana, both of your names are on it. One audience member, if you could assess the future prospects for the SHOP small business marketplace in California, especially as the small market becomes entirely, ACA connected. So first, for those of us who may not know as much as the audience member or you about this, can you tell us a little bit about the small shop marketplace, and just kind of tell us what your assessment is?
Yeah, right. So first, it's rebranded this last year as Covered California for Small Business, and under the Affordable Care Act, most of the attention, rightly, was on expanding through subsidies, help to get people individual coverage. But one of the provisions was also for all states to establish a new marketplace for small business. We've established that. We have about 20,000 people in it. The challenge is that the mechanisms for financial support to lower costs for businesses or the individual employees are limited. There are tax credits, but they're 2 years only. They're hard to get, et cetera. So the main thing that makes a difference for businesses and individuals is making care more affordable. At its core, Covered California Small Business doesn't do that. What it does do is create a marketplace where an employer can pick one option and their employees can pick multiple plans. We actually have in California another private exchange, in essence, that's already doing that. So many small businesses have a choice environment already. I think this is going to be a long-term issue. We will be expecting substantial more enrollment this fall because of small business plans converting in the fall, but it's never going to be huge like the individual market is.
Great. I could keep talking, but we have a commitment to end. So I want to give each of you the last word, and I would like you, if you could just take a minute or so to provide thoughts about what was the big aha moment for you. What should we take for those of us who are so committed in advancing wellness and health care in California? What should we take away from this richness of data and a gift, really, that Mark and his team have provided us? Starting with you, Diana.
Well, I want to thank you, Judy, for your continued support, and the California Wellness Foundation. As I said, the character of this particular survey that has now from 2008 to 2015, and as Mark said, used the same questions, we are really tracking, and I think one of the issues around healthcare reform is accountability and measurement. One thing I didn't mention before, because we've focused so much about coverage, is a task force I established 3 years ago, Let's Get Healthy California, and the work that we're doing there. And in that, we set 39 indicators of health with the goal of California being the healthiest state by 2022. So I think measurement is really important, and the service that the field organization has provided and that you have funded is critically important. The overall message of this year's report builds on the trend that we saw a hint of last year, which is we are really making a difference. Every single number in this poll is moving in the right direction from my perspective, even on the cost. The recognition that we've got, cost is a big concern, but it is less difficult for people this year than last year. Was very dramatic, and the satisfaction with the service, the movement of the industry, the recognition that we're all in this together, all of those numbers are moving in the right direction. I certainly don't have a mission accomplished over the aircraft carrier here, but we have a lot of work yet to do, but we've made a very significant down payment, and as Sarah and Juan have noted, that is in very large part to the depth of community engagement, not just with coverage expansion, but with really demanding, with working with community clinics, as Juan pointed out. That's part of the delivery reform that is critical. And so I will be very eager to look back at 15 years, at 5 years hence. We're 5 years in 2020. It will be very interested to see how these trends continue to move. And so I'm appreciative of the process and the investment that we're all making together.
Yeah, I guess the thing that I'd noticed, and to build on Diana's point, we're 5 years into the Affordable Care Act, and now in California, a state that's really been all in to make it work, support is 2 to 1 in support of the Affordable Care Act. We just passed the 50th anniversary of Medicare. When Medicare was passed, it was incredibly controversial. Today, 50 years later, it's hard to find people that don't say Medicare is the right thing. You can improve it, but the issue of asking people, do you support the idea that seniors get access to health care, you'd say, that's a question you'd actually seriously even ask. And we are seeing in California, and I think this is an important bellwether survey results for the nation, because here's a state that has said, we will seek to use the tools, and in 5 years, dramatic change in support for the Affordable Care Act. And I think it's hopefully a predictor of where we're going, and it becomes a norm that, as Juan noted, we take health care as a right, not a privilege, as the norm in California. You're seeing that in the broad support. You're seeing that in sort of a thumbs up to relatively effective implementation that we look forward to building on.
Great.
This has been hard work, and it shows that it takes everyone to make this a success. And the leadership and commitment that we've seen within California from the legislature, from the governor, from the secretary, from Covered California and staff, from the community, from advocates around the state of California. It's really taken an all-in effort, as Peter said, in order to make this happen. And we are seeing the successes, the results. People feel that it's happening within the communities that we work with, communities of color. We're seeing people get coverage, many for the first time ever. And it shows that people are trying. They're accessing services. They want to get healthy. They want to, they want to get care, and they need help. And I think that's expected too, because this is a tremendous shift in people never having had health care coverage before and never really interacting with the system. And so the improvements that I think we can build on, that the successes that we've made so far, we look forward to the continued partnership that we have with everyone. We want to get it right and get people covered and get people healthy.
Great. Juan.
Yeah, I already mentioned my aha moment when I started, so I'll pass up on that. But I do want to make one thing about the Affordable Care Act is that in the workplace, I've seen a difference because the company has pushed employees to get healthier. There's Zumba classes, there's yoga classes, there's massage therapists that come in on a regular basis. There's contests to where you walk or run, you do some kind of exercise. So I'd like to see a question and, you know, like, okay, what steps have you taken, or have you taken steps to become a healthier person? Because I know that, you know, I know the end result will be, you know, a reduction in healthcare costs for the company and for the employee. So and I think in trying to get California healthier, as Diane said, I think, you know, that's, you know, I see that, and I think hopefully everyone in the room also sees the need to, you know, take responsibility for yourself so that you're healthy, you stay healthy, and you don't become a major cost out of your own pocket and also government or whatever insurance company you may happen to have.
Last word for you, Mark.
Well, one thing I'd say is that the numbers are almost all uniformly moving in the positive direction in this survey. However, I would want to also stipulate that other things that are governing the numbers relate to things that are happening in the broader population and in the state's general milieu of how government is working. I think voters, generally speaking, now have a more positive view of the state's finances than they did back in 2008 and 2009. I think that benefits this issue, and it benefits the poll findings moving in the positive direction. Immigration, attitudes towards immigration are economically driven. There are relationships. When the economy goes down, the public starts to get a little tougher on immigrants. We are in an upcycle in California in terms of the business cycle. People are feeling a little better about the state's finances. They're feeling a little better about their own finances. I think in that general, you have to keep that in mind when you're assessing attitudes about expanding coverage to the undocumented. I root for the state's economy to keep booming right along, because I think that will be a big prod to keep moving this forward, because you mentioned Proposition 187. That was a time of very downturn economics in California. Voters were in a foul mood, and they took it out on illegal immigrants. Even though it was ruled unconstitutional, we don't really benefit from the state going backwards on the economy. So I'd root for the governor and the administration to do everything possible to keep the economy going full speed ahead.
Thank you. Well, as I said, I could continue. I promised you that you'd have lots of data. You'd have conversation from some of the brightest leaders in the state. And we would try to engage you in conversation. You guys asked great questions. I also just want to remind you that things like this just don't happen overnight. I was just kind of pointed in the right direction. But there were a terrific team both within CalWellness and outside. I want to thank the GACI folks who really pulled this all together. And then I had a great support system, our communications folks and our public policy folks. But the leader who kind of told us what to do was Padmini Parthasarthy. Could you just stand, Padmini? I'd appreciate it. Not only does she know how to kind of whip us into shape, but she also leads all of our grant making and social vesting around Affordable Care Act, of which we have invested millions and will continue to do our part in making sure it implements. So I'm sure everybody will make a rush for Padmini afterwards. But I also, want to thank both the team Juan and Sarah and Peter and Diana and Mark. Mark, I know it's been a tough year with the loss of your kind of great founder and leader, but you have carried on the legacy. It's been a great partnership. I thank you all for your leadership and your work in advancing wellness throughout California, and the voters have noticed. It's a huge endorsement, so thank you so much. Take care. Can you join me in thanking them?